So ladies, before we went to break, we were talking about sunscreen, some of the most common mistakes that people make with applying sunscreen. So I know a common mistake is not applying enough or often enough.
Exactly.
Yeah.
So
Or
yes,
before going outside,
Before
right?
going
so
outside.
before going outside, you should apply a sunscreen about 20 minutes, half an hour before, as we mentioned. And then you have to reapply every 2 hours.
And it's like, how much is enough? Like a shot glass amount?
So shot glass, it's a soup spoon would be enough to apply for the body. Depends on the body size as well.
Exactly.
But
Some of us have more square footage than others.
fair good amount to apply on your body, and about a teaspoon for the face.
Okay.
Also, lots of people forget to look at the expiring date on the sun protection,
one.
and they use maybe from the last year. They think I still have a little bit more. It's not good anymore.
And especially
Right?
if it's chemical free and paraben free, then
right.
the
It
shelf life
spoils
is much.
earlier.
Absolutely.
Yeah. Then another common mistake, people think they're going to put sunblock and they're going to use every day. They not reapply it. Maybe they go and go to the water, the swimming pool. They have to reapply it because there is no such a things like waterproof sunblock.
I was just going to say that.
They
Even
are
if it stays,
only
like,
water resistant, and they have to reapply it, the sunblock. And another things they people apply and they think, okay, I'm safe, I can stay all day. Sunblock is not enough. They also have to use the glasses, sunglasses. They have to use the hat. They have to use protective clothes in order to protect the skin.
in the end, it's like anti-aging, right? Like, honestly, I always say sunscreen is probably your best anti-aging secret.
Yeah,
It's your best friend,
It's your
yeah.
best insurance, right?
Absolutely.
So when I go to Shoppers Drug Mart, I go to any store, I see sunscreens that are sort of on the low end of the scale, and then I see super duper made in France, very fancy packaging sunscreens for like $30. Am I necessarily getting better sun protection or a better experience from buying a more expensive sunscreen? I mean, is it one of those products that you're better off spending more money on, or should you be looking at other factors?
Important is the broad spectrum, as you mentioned
So
before.
UVA and UVB.
And
Exactly.
ingredients really is key.
Okay.
Like we have the Ultra MD over here, paraben-free, chemical-free.
So you have those available at the spa?
At our clinics, yeah. And basically, it's not a fancy package, but it's very effective. 16.5% zinc titanium combined together. So really, it's looking at the ingredients versus the nice little package that you may be attracted to, but if you start reading at the back, you may not be protected against both harmful rays.
Okay.
And not necessarily has to be expensive. We have
Exactly.
at Shoppers, I brought the lip chap.
Yeah, you brought us like a chapstick with sunscreen in it, and that is something that a lot of people forget about, right? Like they forget about protecting their lips from the sun.
And the skin is very thinner on the lips. They have to absolutely protect. This lip chap with SPF 30, very good. Price point available at Shoppers Drug Mart under $10. I was very surprised myself when I discovered that. And it's broad spectrum as well. It's great lip chap that can be used also for during the winter against the sun, protects the skin from the dry, environment, help the chapped lips, help moisturize the lips. It's very, very good products. And as I said, under $10, a lots of great products for your husband too, as a gift.
Great. Diane, I want to hear more about some of the therapies and procedures that you have at the clinic for when products and sunscreens aren't enough. Maybe, as Beata said, you've just turned 40, all of a sudden you've exploded in wrinkles and you start to panic.
Absolutely.
So what do your patients come to you to talk to you about?
Not so much in the summertime,
Okay.
but in the fall, after we've gone through the summer and some may have forgotten to use the SPF, they come to me with a brown spot, the sun damage. Like,
So it kind of looks like a freckle?
Yeah, like freckles,
Okay.
but they can get fairly large into the skin. So the longer they are there, the deeper they get into the skin, harder it is to take it out. So we would take care of that with laser treatments. So we can surely do like facial peels prior. Think of your skin like a piece of wood, if you will. So you have a piece of wood, you don't like the color, you need to strip it in order to put in another color, right? So the skin is the same. We start off with a facial peel, make sure it's exfoliated, and getting it ready in order to receive the laser treatment in depth. So we can do several treatments with the laser, remove the pigmentation.
Is it painful?
It's not painful. Well, the one that I have is not painful. I've used like other ones in the past where it feels like a pinching elastic band, pinching your
even
skin.
if you're a big baby like I am, it's still okay?
Yeah, no,
Okay.
this one does not hurt, I have to say. I always tell my patient, if I hurt you, you can hurt me back.
Oh,
so
okay.
that
That's
typically
dangerous.
works. That typically works. So that's a big service in the fall. Right now in the summertime, the biggest service is cellulite reduction, body contouring, skin tightening, and we also do like collagen renewal, fibroblast renewal with Trilipo Maximus. So it's preventative.
Tell me about Trilipo.
So Trilipo is radio frequency technology. So it's been around forever. The radio frequency and medical, if you will. And then Polygen came out with the Trilipo actually a few years back. Very effective, not painful, no downtime.
Is radio frequency like an ultrasound? Is it a laser? Like what is it
It's not
exactly?
a laser and it's not
Okay.
ultrasound, but
Okay.
it does penetrate deep into the skin, right?
And why is it a better modality?
I find that it's better because it stimulates the collagen, the fibroblasts, the blood circulation, and oxygen into the skin. So dependent on settings that I input into the machine, we can actually liquefy some little fat tissue.
Okay.
So most of my clients that come for like body contouring or cellulite reduction, for example, I liquefy the little fat tissue. I also have a DMA, which is deep muscle activation, and I make their muscle work. You can actually see.
Ooh.
Yeah, it doesn't hurt though. It's not painful. Most of my clients fall asleep when I'm doing this.
Okay.
But then after they're required to drink a lot of water. So whatever I've liquefied will be flushed out
toxins.
through lymphatic drainage.
So you sent us some photos of how your skin around your jawline got. Was that using Trilipo?
That was Trilipo.
Okay, so maybe we could pull up some of those photos to see. You sent us some before and afters of your face.
That was
And
I
you
think
used-
I believe that my pictures you're going to
You
see.
used so there you are. There you are. That's a before.
Yes.
And then let's see the after. So that's quite a big difference after
Yes.
only one treatment. You said
That was 1 hour
Yeah.
apart.
an hour apart.
An hour apart.
Wow.
Yes.
And so you're done, or you keep going? Like, do you need a lot of
So
maintenance?
the protocol, as per the clinical studies, is 6 treatments, 7 to 14 days apart. Okay. So the first 3 sessions, I start waking up the collagen because as we age, it starts going down, right? So we need to wake it up a little bit. And the last 3 sessions is when I do the sculpting, the lift, and all that. So the protocol is 6 treatments, but there's no contraindication, there's no downtime. Medicine, nothing can interfere with this treatment. So I have clients that have done the 6 treatments. They love it so much that they keep on going. So you can keep doing this 52 times a year, once a week if you'd like.
And you have some clients who are cancer survivors.
Absolutely.
Are they okay to use these sorts of procedures?
Yes, so I have several clients that I perform Trilipo Maximus on that are cancer survivor. What I typically do is I like to get some information from the oncologist. So we get an okay from the oncologist, depending on the cancer and whatnot. But we're very, very safe, very disciplined with that.
Okay. And you also sent us some photos of some procedure being done on someone's face using a different technology called Oxygeneo.
Oxygenel, yes.
Maybe we can pull up those photos to see some of the before and afters. And again, it was just after one treatment. Yeah.
Yes.
So we'll just we'll wait a second to get those photos pulled up. But tell me a little bit about. Oh, here we go. So that's a really big difference.
Exactly, it's a huge difference. So
What
when
are we
I'm
treating here? Are we treating rosacea? or
pigmentation and rosacea,
Okay.
2 different pictures here. So when I'm using the Oxygeneo, I have 2 different serums that I can use. So one is called the Neo Revive, which is geared towards rosacea and aging skin. And then I have what we call the Neo Bright. So Neo Bright is more for pigmentation, which contains kojic acid, which derives from mushroom, which becomes a skin brightener.
So tell me a little bit about the significance of the mushroom extract. Again, that's safer to use for people who don't want to put too many chemicals on their skin. Or...
Absolutely.
Okay.
So I always tell my clients, if you Google kojic acid, you can actually read up, like back in the day, Cleopatra and all these beautiful ladies would ask their servant, if you will, to crush a mushroom paste and they would actually put it on their skin, and it became a skin brightener.
So these are obviously not mushrooms I'm going to find at Loblaws, right? Like these are Where do you get these mushrooms from?
I'm not exactly sure,
Okay,
but
okay.
most of them contain kojic acid. So
Okay, I didn't know that.
Yeah.
It's fascinating.
it's
So-
pretty fascinating in what it does, because like we have what we call the Pigment Bar over here.
Yes, tell me about the Pigment
So
Bar.
the Pigment Bar is incredible. The way that I showcase it to my clients is I will cleanse their hand and then just let them see the difference between the complexion of their skin. So I have a lot of clients that are Middle Eastern, so skin type 6, and they tend to get a lot of dark pigmentation into the creases of the neck and the elbows.
Is that from sun exposure?
It's just their
hereditary,
genetics. Yeah, it's genetics. And for them, like, it can be embarrassing because it looks almost like their skin is dirty, but it's not. So by using the pigmentation bar, it's a cleanser, basically a sponge. You lather, pick up product, go into a circular motion, leave it on for about a minute, rinse it, and the difference is incredible. Again, it contains kojic acid, so it's skin brightening and even out the complexion.
Can you use it every day?
Absolutely. So at the beginning, I recommend using it every second day. Oops, sorry. In order to see how you react, because it could be drying also.
Yeah.
So you have to be a little bit careful. And then after that, if everything goes well, I use it every day.
Can you use it everywhere?
Everywhere. I use it on my face, neck, décolleté, my hands. I have clients that basically use it as a entire body cleanser. Yeah, very effective.
Interesting. And where is it made?
It's actually made in Canada. It's made by PCA.
Oh, that's nice. So it's a local
So-
product.
Yes,
Yeah.
most of my products that I have here are made in Canada. So Vivier Pharma over here,
Okay.
as well as the Platine line over here, is actually from Montreal.
Okay.
So we're very fortunate to have them very close by, but they've been around for a long time, 25 years. So really proud of that.
Anything else that you haven't told us already about some of the skincare products that you brought in?
We have the Blemish Bar also. So that is really awesome for people that have oily skin and also have acne prone skin. So during the summertime, because of the sun exposure, you have to be careful with glycolic, salicylic acid. So we're kind of limited in the summertime when it comes to treatment in our clinic. So we have to find alternative ways to cater to our clients in maintaining their skin during those 3 months. So the Blemish Bar has been amazing. It is incredible for acne. So a lot of men have acne on their back.
Okay.
Not so much the ladies. I don't see a lot of ladies with that, but mostly the men. So this will keep it at bay.
Great.
And again, no contraindication. And of course, we always recommend using the SPF
Of course. Yeah.
afterwards. Yeah.
Can you use all of those products during the summer, or some you should avoid?
All of these can be used in the summertime.
Okay.
So those are safe. In the summertime, I would avoid in the morning using a retin-A, a tretinoid,
Okay.
hydroquinone products. You can use those in the evening when you're going to bed. Your correction products, I would say, use them at night in the summertime, depending on the percentage of, let's say, a vitamin C, for example. If it's a high concentration, I would keep it for nighttime.
And of the procedures that you offer at the clinic, you can use the Trilipo in the summer. You can use the
Absolutely.
Oxygeneo in the summer, which is a time when you can't use most kinds of procedures on the face, right?
Exactly. So the Oxygeneo, for example, we just launched about 6 weeks ago, and the response has been amazing. I love it, like incredible. The results last for about 4 to 5 weeks.
It's amazing.
It's incredible. Gets rid of pigmentation, also gives you like a lift. So sometimes I have patients that have the laugh lines over here,
Yeah.
and I was kind of playing around yesterday with it, and you're pretty much smoothing out those lines. It's
Sounds amazing. And
Yeah.
again, I want to remind our viewers that Diane is actually giving one of those facials away, so call 613-759-8622 to put your name in the draw. We have a few minutes left before we go to break, and I couldn't resist. You mentioned to me when we were chatting on the phone earlier about a procedure you offer that's not invasive, and it allows you to resemble Kim Kardashian. Not in the face.
Not in the face.
One of her other lovely assets. So how does it work? And you said you have people of all ages coming in for this procedure.
Absolutely.
So it's lifting your bum by a couple inches.
Yes. So we utilize the Trilipo Maximus.
Okay.
And because it has the DMA, the deep muscle activation, I can make that muscle work
That's amazing.
over time. So my clients get a kick out of this because I'll start off, let's say, on the right bum cheek.
Yeah.
And I work on it, and then I stop halfway through and I take a picture. And one side is lifted up to here, and the other side is
So
down
how long
here.
does it last?
Actually, it's the same protocol as my body contouring or cellulite reduction. So
Okay.
we basically do 6 treatments.
Okay.
And then after that, 1 session every 3 months just to maintain the work that I've done. But it's pretty phenomenal. The challenges with the buttock lift
Yeah.
is making sure that I'm symmetrical at the end.
Yes, yes, that would be
Not have-
awkward.
It would be awkward,
Yeah.
like walking around lopsided.
Yeah, and you have ladies who are 7 years old coming in for this procedure, you said?
I have all kinds of women, all ages, and also men. Not so much for the buttock lift, but for Trilipo Maximus treatments. It's amazing how they want their midsection to look very contoured and firm.
Contoured.
Exactly.
Yeah.
Exactly.
Fantastic. We have a couple minutes left before the end of our segment with you, Diane. Is there anything that you'd like to add that I haven't asked you, or anything going on at the clinic that you'd like to talk about?
I think that I'd like to say that we have 3 board-certified doctors at our clinic. So this is not exactly, we can do this all year round actually. So the Botox, the dermal fillers, the Latisse, and we just recently launched Belkyra, which is injectables for the double chin.
Yeah, I've heard about that.
Yes, it's pretty amazing. So we just launched like a few weeks back. So this is new to the clinic, and of course the Oxygeneo is new to the clinic. So we have a lot of things happening.
And all these procedures are non-invasive, which is
Non-invasive. We don't hurt people, like so it doesn't hurt. Most people fall asleep during most of our treatments. So
wonderful. And where can we find you?
you can find us in the Manotick News, so 1160 Beaverwood in Manotick. We're right next door to the Rexall Pharmacy.
Okay.
Sorry, I know you're at Shoppers, but right next door to Rexall.
Wonderful. Well, thank you so much for joining us tonight.
Thank you for having me.
Our viewers are lucky to benefit from your expertise. So don't go